Hi there, this is Dr. Paul Oakley. I've been using the Spinecor, the first dynamic and corrective brace for the treatment of scoliosis for several years now, for adults and pediatrics or kids. The brace is very effective, and considering the alternatives, it's probably your best option. What you're going to witness now is a live testimonial from one of our patients that we have helped.
Hi, my name's Caitlin. I'm 11 now. I've been in the brace for a year and 7 months now.
Can we actually just see the brace on you?
Looks like this, but I put the skirt on.
Can you turn around a little bit? Okay, good. Thank you. Okay, and so what have been the results so far in the brace?
I started at 34 degrees and I'm at 30 now. We just came back from a sick kid's appointment and the good news was 30. It was before we had the appointment, I was out of it for 24 hours and the x-ray said I was 30 degrees, so it's much better now.
Yeah, out of the Spinecor brace.
Yeah.
Right. Okay, and so how does the brace feel?
At first it was a little uncomfortable, but now I've gotten used to it. Like at first, every brace that people have had, it probably was uncomfortable at first. The hardest part for me would be sleeping in it this first few days.
How is it now to sleep in?
I sleep like a rock.
So no problem at all?
No.
Excellent, good. What would you have to say to kids like your age who have scoliosis and maybe they're thinking about getting the Spinecor brace? Would you recommend it to them?
The Spinecor brace is very good. I can't really run in it now, but if you get it upgraded to shorts and everything, you'll probably be able to do a lot of sports in it, which is what we're going to get it upgraded to.
In comparison to what the other braces are out there, this one is the best for you.
Yeah.
To be able to
this is
move
the other one,
and exercise.
Right?
Yeah.
This is the Boston brace. This is actually a brace from Sick Kids Hospital, donated a couple years ago from one of our patients. Yeah, so this is very limiting.
That's limiting.
Rigid brace.
This is not limiting.
And Karen, Mom, what are your thoughts on your daughter's brace, the Spinecor brace?
Your turn.
Well, when she was diagnosed at 9, I was quite shocked that she was so young, because I am also somebody who has had scoliosis at a young age, so I was watching for it, and when I found it, I was very upset. I came to see Dr. Oakley, and he had told me about the Spinecor, and I had been looking at other treatments, but definitely the Spinecor treatment is something that kids can adapt to a lot better than the Chanel that we just saw a minute ago.
Before I got into it, my mom went online and searched videos. So I got to see a 14, 15-year-old girl on the Chanel
We
brace.
did our research.
She could really move.
But I'm very, very proud of Caitlin for being able to accept this treatment and be regimented on wearing it.
Sometimes when I'm out of it, I don't want to get back into it.
Those things are going to happen with just anything. So we are very, very pleased with the Spinecor results.
And Karen, do you have any advice for maybe some like parents like yourself who at first were doing their research online and everything and getting different information from different doctors and not sure what to do? What would you say to them?
Say to the parents that if they're not very familiar with what scoliosis is, to definitely familiarize yourself, because you get a lot of different opinions given to you by different doctors, and you know, you have to go with your gut feeling, and Spinecor is by far the one that is most adaptable to a child. And if you want them to accept the treatment that you're proposing as a parent, you also have to look at the comfort zone and their well-being and personality and what they're going to be viewed at through their peers. I mean, if they're wearing a Chanel brace that's worn on the outside, their confidence level is going to diminish, and their positive attitude towards correcting the scoliosis or trying to correct it, they're going to rebel if they're wearing something that's not comfortable to them. And quite frankly, Caitlin, you do wear it, and you are very good at wearing your brace at all times.
Excellent.
So, I highly recommend it, and I mean, it's definitely something that when you diagnose it, you have to take the time to think and research what's best for your child.
Okay. Well, thanks, guys.
You're welcome.